Hello, lovely. How are you? Nice to meet you. I'm Dr. Nicola, and I'll be carrying out your cranial nerve exam today. So, let's get straight into the exam. How is your sense of smell? Do you think it's okay? Alright. I've got a few things for you to sniff. Alright, my lovely. So, this is the first item. Give it a nice big sniff for me. Can you smell it? And what is it? Okay. Next one. Take a nice big sniff. Okay, can you smell it? And what is it? Okay. And final one. And take a nice big sniff. Can you smell it? And what is it? Great. Now, if you wouldn't mind just blowing your nose with the tissues there for me, okay? Lovely. Now, I have another one for you to smell. Nice big sniff. Can you smell it? And what is it? Perfect. Another one. Sniff. Can you smell it? And what is it? Last one. Take a nice big sniff. Can you smell it? And what is it? Now, did you find that the smells are clearer when you blew your nose? Okay, or were they the same? Okay, wonderful. Okay, it's all good. Now, I want you to look at my nose. Just with your eyes. Can you look here? And here. Excellent. Look at my nose. Now look at my finger. I want to follow it just with your eyes, okay? Good. Well done. Back at my nose. Look here. Nose. Here. Nose. Here. Nose. Here. Nose. Here. Nose. Excellent. Keep looking at my nose. Put my hands here. And I want you to keep looking at my nose and tell me which side you see me wiggle. Okay. Get it. Excellent. Well done. How many of me can you see? Perfect. I want you to look at my hand, just in the centre there. Okay. Keep looking there. Then look at my finger. And then at my palm. And then my finger. palm, finger, palm, finger, palm, finger, palm, finger, palm, finger, palm, finger. Excellent. Okay, look at my nose. Look at the light. Now just with your eyes, I would like you to follow it. Okay? Keep following the light. Good. Perfect. Look at my nose. Keep looking at my nose. Okay. Look at my finger. Light. Finger. Light. Nose. Look at my light. Finger. Light. Finger. Back at my nose. Light. Finger. Light. Finger. And back at my nose. Light. Finger. Light. Finger. And back at my nose. Keep looking at my nose. Look at my finger. Light. Finger. Light. Back at my nose. Look at the light. Finger. Light. Finger. And back at my nose. Light. Finger. Light. Finger. And back at my nose. Excellent. Well done. Okay. Look at my nose. And don't look at the light. Keep looking at my nose, not at the light. Just my nose. Don't let the light distract you. Keep focusing on my nose. Good. Just my nose. That's it. Keep focusing there. Good job. Just my nose. Perfect. Now keep looking at my nose and don't look at my finger. Okay. Just look at my nose. Don't let my finger distract you. Just my nose. Good. Perfect. You all right? Good. Look at my nose. Don't look at my fingers. Look at my nose. Excellent. Look at my nose. Look at my nose. Tell me when you can see my fingers. Good. Tell me when you can't see them. Excellent. If you can just look straight ahead at me and don't move. Okay. close your eyes and open them. Close, open, close, open, close, open, close, open, close. Okay, and open. I want you to flutter your lashes as fast as you can. Stop. I want you to blink as fast as you can. Slow it down a bit. And a bit more. Now really slow. And stop. Now when I say blink, I would like you to blink. Blink. Blink, blink. Blink. Blink, blink. 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 Blink, blink, blink. Blink. Blink, blink, blink. Blink. Blink, blink, blink. Lovely. And what are you like winking? Give it a try for me. This side. And that side. Good job. Which side do you find easier? Okay. I want to combine the wink with the blink. And I want you to just wink with the eye that you can the best. If you can do both, do both. Okay. Blink. Wink. Good job. Wink. Blink. Wink. 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 Blink. Blink. Blink, blink. Blink, blink. Wink. Blink. Blink, blink, blink. Blink, blink. Wink. Wink, wink. Blink. Wink. Blink, blink, blink. Wink, wink. Blink. Wink. Blink, blink, blink. Good job. Now I'd like you to do a few different things with your face. This is just going to give me an idea of your facial symmetry, your structure, just to see if there's anything out of place. Alright. So, sit there with no expression. Now this can show me how your face sits naturally. Okay. Good. Now, I would like you to smile, just a normal smile. Perfect. Now can you make that a little bit bigger? And now, so big I can see your teeth. Good job. Relax. Now, raise your brows for me as high as you can. Good. Now I'd like you to frown. Good. Relax. Can you scrunch your face for me nice and tight? Perfect. Now, I would like you to close your eyes. Now, can you close them really tight? Good. Okay, open. Can you puff out your cheeks? Now, if you can suck them in as best as you can. Relax. I want you to wiggle your nose. Okay, stop. I'd like you to pout. Good. Now get your lips and suck them in, like so. That's it. Now nice and tight. Relax. Perfect. Okay, now could you open your mouth? Close it. Open, close, open, close, open, close. Now can you do a chewing action? relax. Can you pop out your tongue for me? Can you wiggle it around? That's it, different directions. Okay, wonderful. Now, if you could pop your tongue on the roof of your mouth. Good. In that cheek. And the other cheek. Good. In the lower lip, so in your chin. That's perfect. And what about your upper lip? Okay, now maybe try and pop your tongue here and here. Perfect, that's brilliant. And relax. Great. Brilliant. Right, so I'm just going to pop on one glove. Okay, now I'm going to see how your feeling is in your face. Okay, so tell me if you can feel me touch. Good. Same again. Okay, so you could feel both of those. Now, close your eyes for me. I'm going to touch you with my hand and I want you to tell me if it's gloved or not. Okay. And open. So could you feel the difference? Okay, so how do they feel? How's that feel? And what about that one? Okay, all right. So as I'm doing this, can you feel a clear difference? So keep focusing on the sensation. Can you feel the difference? Okay, now close your eyes and let's do the same again. So focus on sensation. And open. Okay, so could you tell a clear difference? Lovely. Pop on my other glove for a little bit. Okay. Okay. I'm now going to touch your face with a different object. And I want you to tell me if you could feel it. Okay, so you could feel it. What does it feel like? Describe it. Okay. And what about that? Okay. Now, do they feel the same on both sides? Do they touch at the same time? Do they feel the same? What about that? Wonderful. Close your eyes for me. I want you to tell me when I touch. Okay, wonderful. You can keep your eyes closed for me. I'm now going to bring in a different object. I want you to tell me if you could feel it. And how does it feel? Okay. Okay. Now, tell me when I touch. Wonderful. Open. Look straight ahead. Now, does that feel the same as it did, or does it feel a little bit different now your eyes are open? Okay, tell me when I touch. Just look straight ahead for me, my love. That's it. Okay. Perfect. Now, if you could close your eyes, I'm going to use another object now. Okay. Could you feel that? Okay. How does it feel? Describe it. Okay. Tell me when it touches your face. And open. Look straight ahead and tell me when I touch. Good. Excellent. Close your eyes. Okay. Can you feel that? How does it feel? Describe it. Good. Tell me when it touches your face. And open. Look straight ahead and tell me when it touches your face. Excellent. Tell me, were things heightened when your eyes were closed or open? Okay. Now, tell me, can you feel that and that? Do they feel the same? Okay, so one feels bigger than the other. Okay, good. So I want you to close your eyes and tell me when the big one or the small one touches your face, okay? Big or small? Excellent. Open your eyes and look straight ahead. Same again. Just look straight ahead. Excellent. Okay. Close your eyes for me. Okay. Can you feel that? That. And that. Do they all feel the same? Okay, good. Right, so can you tell me which is which? Okay, so this one. Okay, you think fluffy. Okay, this one. Small. This one. Big. Okay, so tell me which one touches your face. And open your eyes, look straight ahead, and same again. Focus straight ahead. Good. Perfect. Oh, wonderful. Close your eyes. Tell me, can you feel that? Okay. What is it? Good. Tell me when I puff the air, okay? Can you feel it? And open. And same again. ahead, just ignore what I'm doing. Good. Great, so out of all of that, do you find that you can feel it a lot better with your eyes closed or open? Perfect, my love. Okay, happy with that. Now, can you hear me okay? Good. Now I'm going to put my fingers next to your ears, okay? And I want you to tell me when you can hear something, okay? So could you hear that? Okay, good. Lovely. Okay, now tell me which side is clearer. Okay. Okay, wonderful. Okay. Hear that? Okay. Now tell me which side's clearer. Okay. Wonderful. Okay, so I want you to tell me when you can't hear the sound, okay? Ready? Okay, so can you hear a significant change? Going loud to quiet. Same again. Okay, now I'm going to bring the sound back to you. So it's going to start off quiet and then obviously become louder. Tell me when you can start to hear it, okay? Lovely. Same again. So could you hear quieter to loud, loud to quiet? Good. Now I'm going to whisper a couple of things in your ears, if you could just repeat them, okay? Okay, great. Beautiful. Relax. Okay, now I'm going to turn around and I would like you to repeat. Relaxing. Sleep. People. Purple. Wonderful. Wonderful. Nerves. Okay, good. Did you find it difficult at any time? Okay, good. just swallow for me. And again. I'm going to put my hand there. Swallow. And again. Good. Open your mouth. Go ah. Pop your tongue out and say ah. And relax. Would you mind just having a sip of the water just to clear your throat a little bit? I'm now going to check your sense of taste. So what I'm going to do is pop a little bit of the product on your tongue. I would like you to tell me if you could taste it, if it's sweet, sour or bitter, and what it tastes like. Okay, this is the first one. Pop out your tongue. Good. If you can rinse your mouth. Next one. Pop out your tongue. Good. Rinse your mouth. Okay, and final one. Pop out your tongue. Good job. Yeah, you can rinse your mouth. Okay. Right. You okay? Right, if I could get you to shrug for me. And again. And just this side. And that side. Good. I'm going to pop my hands on you. I'm going to shrug. Again. Now I'm going to push you down and I want you to try and push me off, okay? Wonderful. Okay. Can you pop your head right the way back as far as you can, but carefully? Back to the chest. Back that way. Back that way. Back. Can you rotate your head in a full circle? And now back the other way. Good. Wonderful. Hold my hands. Squeeze nice and tight, but not too tight. Release. Squeeze. Release. Squeeze. Release. Okay, good. Now, just this side, hold my hand, squeeze, nice and tight, release, squeeze, release, squeeze, release. Okay, this side, hold my hand, squeeze, nice and tight, release, squeeze, release, squeeze, release. Okay, wonderful. Pop your hands against mine. Okay, push me. Okay, now I'm going to try and push you back and I want you to try and push me away. Okay, relax. You okay? Good. Just sit nice and tall for me. Perfect. Not bad. Not bad. Did a did a great job. Did absolutely fantastic. Alright, it's your cranial nerve exam complete. Everything is working as it should. I don't have any concerns at all, my lovely. Alright, so you don't need to worry about anything. It is all working as it should. You're very welcome. You take care now. Bye bye.